Mindfulness Based Cognitive Therapy is an 8-week intervention. It's usually done in a group and it's 2 hours in duration. The original idea behind Mindfulness Based Cognitive Therapy was to support people with chronic depression, and it's been adapted for different populations. So what the idea is that there's a group facilitator. They'll walk people through different exercises over the 8-week period, and will also provide psychoeducation around about their thoughts, around people's emotions, a bit more information around how they operate together, and physical sensation and the bi-directional nature of them. So if something is impacting your physically, so if psoriasis, that might impact how you think. So you might think more negatively about what's going on around you. You might feel sadder as a result. So kind of how to explore those particular your physical emotions and your thoughts. And then it's around really kind of sitting down and learning how to meditate and going through that practice. So through body scanning gives you greater awareness of your body. It allows you to change your attention. So if you're thinking about something or worrying about something or ruminating about something, oftentimes if you focus on the body, what will happen is your attention will shift back to the present, and from that usually what happens is the negative impact of ruminating and worry, which can cause stress and anxiety, will oftentimes just dissipate, and you'll be back and you feel more centered and much more relaxed, and your well-being should hopefully improve because of that. So it's a gradual process, so it's a fairly intense intervention in a sense, but it's really, really good. So people will then, as part of their homework, will be asked to meditate for 35-40 minutes, 6 out of 7 days, just to get that practice built up. And by the end of the 8 weeks, participants ideally will have actually quite a detailed experience of mindfulness itself. And within the interventions itself, talking to the facilitator, they'll walk through your individual experience to help you kind of learn about what you're experiencing yourself. So you'll have someone with you who will actually do the meditation, and then there's kind of like a question and answer session after each particular practice to help you really integrate that into your life. And then the last week in particular is around kind of integrating how you're going to work it into the rest of your life. And it's based on, there's aspects of cognitive behavior therapy in it too. So week 5 and week 6 or 4 or 5, they really walk through about like how we can spiral. So if we have negative thoughts, how we can spiral, and it can actually really impact our mood quite negatively, and how to avoid that, and how mindfulness can actually help you from stepping out of that kind of spiral.